My name's Naomi Houston. I work for the Nepean Blue Mountains Local Health District. That's in Penrith, which is the foothills of the Blue Mountains. I've been there probably about 20, 30 years in different capacities, but probably in stomal therapy for the last 12 years. Preoperatively, I think one of the number one aspects is that the patients have fear. I think they come in often very reluctant to want to have a stoma, and they don't really want to meet you, and they don't really want to know what you have to say, but they feel that they need to be responsible. They should really just find out information. And I've had patients who said to me, Naomi, I've been diagnosed with bowel cancer, but I'm more frightened of the bag than what I am of the diagnosis. So fear is a big factor, and I think when I see them before an operation, I don't want to go in there and overload them with information. The main things they want to know is, who are you? Can I trust you? Will you be with me through this? And can you go step by step? So I think for me, it really is gauging what's happening for them, giving them the right information, helping them to understand a little bit about what's the operation and our expectations too after the operation. And they're very frightened. So I often say to them, I use an analogy. I say, sometimes having a stomach, and in the very early days, you feel like you're on a ship and you don't know how to sail, and you don't know where land is, and you're there by yourself. And that can be a really frightening, overwhelming experience. And then I say to them, but I'm going to be on the boat too. And I won't get off that boat until I know that you can sail and that you can drop me off. But it's important sometimes to even give them a bag, show them a bag, and even if it's a drainable, see if they can undo a bag and do a bag up again, because just that practical side can give you an idea, will this person be able to follow instruction afterwards? So that's a simple little exercise that you can do, which another STN told me, and I think it's a really good idea. You can show them, I sometimes show them videos on life with a stoma, or I'll point them to a website where they can look at that, and it's just a 5-minute little clip that gives them an idea that life goes on afterwards. Often they feel there's a sense of security in hospital, and they sometimes are very frightened to leave because they sort of think, well, when do I need to change my bag? But the policy in the hospital that I'm in is that they don't get discharged until they are confident and competent in being able to change their bag. And sometimes if they are struggling and they have family or people, carers, I will bring them in to give them that reassurance, if they're able to, that is, so they can go through the various steps, so there is some confidence out there. I also say to them, if they have any concerns, to give me a ring. And it's sometimes because they can get mental blocks, and sometimes they just give you the answers that they know you want to hear, and it's not until they go home thinking, what on earth am I supposed to do now? And so they have those mental blocks, and I say, listen, sometimes it's just a matter of a phone call. They can page me. If it's not urgent, they can leave a message on the answer machine, but otherwise they can page me, and I can just go through some of those things that they're concerned about. The other thing that I do is sometimes for a patient to initiate help, it can take a lot for them to do that. Whereas I sort of feel part of my responsibility is to initiate that step. So when they go home, within that probably a week, I'll just give them a call. How are you going? Are you all right? And sometimes they find that comforting and reassuring, and I can just touch base on a few things. It takes them a little while to get their confidence up. Sometimes they have to process things that they've learnt in hospital, and they have to go through that themselves. Often it just depends on how long they've been in hospital for, but often one of the things that they do go home with is often tiredness. They don't know what is acceptable, and I often tell my patients they're allowed a morning siesta, an afternoon siesta, and early to bed. I say to them to get up in the morning, prior to breakfast, if they need to change their bag, change the bag. I then want, and I encourage them, because patients have become a bit isolated. They once they get home, they sort of think, well, that's it. I don't want to go out because what happens if my bag leaks? So I encourage my patients to say that after you've changed your bag, I want you to go for a short walk. Whether it's just to the letterbox, which might be only not far away, or might be down a long driveway, or to the corner of the street, and to gradually do that every morning and increase that. So they can get outside and say, oh gosh, it's a nice day today. Oh, the flowers are out, or so-and-so's here. It gives them a feeling that they don't have to be locked in their box. It gets them the confidence and courage to go out, and sometimes they don't necessarily bump into people that they know, because sometimes they're a bit worried about that. And then when they come home, I encourage them just to have their breakfast and a cup of tea, then they can have a morning siesta. When they wake up, something simple, it might be a cup of soup, or it might be a toasted cheese sandwich, something like that, and then an afternoon siesta. So I try, and then early to bed later on. So I try and give them the feeling that they can do things, but also that rest is okay, it's acceptable. I think it's really important. I mean, for me, I see my patients initially 2 weeks after discharge. I mean, it might be a week earlier if I'm concerned about them in hospital. But generally say it's 2 weeks, and then it's 4 weeks after that. On the last one that I see them, I really emphasise the importance that the colour of the skin around their stoma needs to be the same colour as the colour of skin over here. I want to go through the order form, because there is a danger of over-ordering, and you hear these horror stories of patients back home with a lounge room full of products. So we go through that, and I often say to them, okay, early in hospital you might have had removal wipes or barrier wipes. Well, we'd like to encourage you should be able to peel this off like a Band-Aid. Sometimes they still need them, but to give them the feeling that they can make choices about the order. So I'll go through the order form. I do talk about hernia prevention, and about coughing and sneezing, what sort of things they can do to prevent that. And if they have any concerns, certainly contact us.